Hi there, I'm Dr. Nicolette Picerno from FacesFirst, and I wanted to introduce my patient Erica, who's about 3 months after upper eyelid surgery and an endoscopic brow lift. I don't know, Erica, how do you, what made you finally just not even choose FacesFirst, but just choose to come and talk to someone about having surgery on the eye and brow area?
Sure. Yes, well, I in the workforce, I got very tired of people asking me all the time, do you feel okay? Are you tired? Even when I felt well rested and I felt good about myself, and I would have people say, you look tired. And you're like,
I'm not tired.
I'm not tired. I feel very good. Yeah. And also during COVID, being on, working from home and being on the camera all the time, I really noticed that kind of haggard look. The camera kind of amplified that a little bit, and I would notice myself looking at that and thinking, I wish I could do something, maybe a little more eye makeup, maybe some more mascara, maybe some eyeliner,
more, maybe if I smile more.
Exactly, yeah, trying to raise my eyebrows a little bit more, that sort of thing. And I really just thought I would like to do something. I think it would boost my confidence, even if other people didn't really recognize it. I think it would make me feel better about myself. So that was ultimately the deciding factor in coming into to seeing what could be done and what my options were.
So when you got here, I'm sure you looked around a bit, but when you got to us, how did you finally make the decision to pick us to do your surgery?
It was the staff. It was the support that I felt from you guys, and the excitement that I felt that you had. We can help you. This is easy. We do this all the time. Here's your options. Here's what you can do. Here's what you can expect, and that's how I ultimately chose to come to FacesFirst.
That's really nice to hear, because I have a lot of staff that have been working with me for a very long time, and I think that's one of an assets of FacesFirst, is that the longevity of the staff and the experience of the staff.
Exactly.
So it's reassuring to hear that came across to you as well.
Yeah, the love of your job really came through. So it made me feel confident and excited for something that could be a little concerning,
scary.
Yeah.
How was your recovery?
My recovery, I think, was fine. I never felt any pain. I had some discomfort, obviously. First night, it was a little, well, my eyes were swollen, a little bit,
a
little gritty, and I just, it was a little difficult to sleep. I didn't really have a headache. It wasn't so much the first couple of days. It wasn't the brow lift. It was more of the upper eye lift. Yeah, that was a little uncomfortable, and I just had a little trouble sleeping.
Really
no pain. I would say no pain whatsoever. Just
Well, you look amazing.
Well, thank you so
I think
much.
you had a really good outcome. I don't think I would change anything.
Thank you.
I also just want to touch base on the fact that, Erica decided to do her upper face, and some patients decide to do their lower face or their upper face or just their eyelids or just a laser for wrinkles or brown spots. You don't always have to do this huge procedure to get a confidence boosting, youthful appearance with a smaller procedure that is easier to recover from. Exactly. So I just want to make sure that patients, that you feel like it was worth doing.
I feel like it was worth doing, yes. And anything, I would recommend anything. If anybody has anything that you feel uncomfortable about, that you think, oh gosh, I could, maybe I could tweak this, maybe I could fix that, go for it. Because even if other people don't recognize it, the boost in confidence that it gives yourself, that is worth everything. Yeah.
We don't always have to do this full, huge, big procedure. We can do smaller things with a big impact.